Thank you, Jade. I'm going to ask Petra to share the slides for me so you can all see what I'm talking about today. Thank you very much, Petra. So today we're really going to be providing an overview of the child and youth mental health and substance use care continuum and how to access it. Now, as you'll see from the chat, there's really a diverse range of participants on the call today, many of whom don't explicitly work within a mental health and substance use service or setting, so are not necessarily familiar with the structure of mental health and substance use services. So we're really today going to try and set the stage for this 5-part education series and ensure that all participants have a clearer understanding of the care continuum. Next slide, please, Petra. So by the end of the session, if I do my job well, you should understand the importance of service navigation, the different levels of child and youth mental health and substance use care, know what child and youth and mental health and substance use services are broadly available and how to access those services, and understand the link between a child's needs and the level of service provided. Next slide, please. So mental health and substance use care, what exactly is it? Well, for most of us, if you're like me, when you hear the term child and youth mental health and substance use care, an endless acronyms usually springs to mind, everything from CYMH, EPI, APU, PIPU, and in addition to the acronyms, there's usually a string of service providers, and on top of the service providers, there's a number of ministries and government bodies, and then to make it a little bit more interesting, we tend to throw in a number of different job titles too, everything from clinician, key worker, social worker, psychiatrist, psychologist, etc. Next slide, please, Petra. So ultimately what it all amounts to is a very confusing system of care. So we'll just say that at the very start, the sheer volume of services out there, each with very different referral pathways and mandates, makes it extremely difficult to navigate care and get access to the support when you need it. And those unnecessary delays in that confusion system can have a substantial impact, not just on the youth, but on the care system as a whole. Next slide, please. So unnecessary delays in treatment, they have the potential to exacerbate mental health and substance use conditions, which can then lead to repeat referrals and readmissions, and thus contribute to the demand for services and the long wait lists for treatment. So it's really important that we all strive to ensure that care is accessible, timely, and coordinated across the entire care continuum. Next slide, please. So how can we do that? So in terms of system improvements across the entire care continuum for mental health and substance use, there's many collaborative efforts underway at the moment to improve access and coordination. So we have things like Foundry teams popping up across the region, and they really offer young people health and wellness resources, service, and a range of supports through integrated service centres. We have family connection centres, which will provide one-stop location for support, therapy and information. And we have the integrated child and youth teams, or the ICY teams, which aim to bring services together in a multidisciplinary setting to make it easier to connect, for children to connect to the care they need. But of course, these new investments take time to implement, and in that time, staff are left trying to navigate the complexities that exist within the system. So what can staff do on an individual level? And I think one of the most simplest things we can do is rethink the roles of families and communities. The most powerful and effective resources and supports in the care continuum often lie within a child's social and community network. So it's really important that whenever possible, we incorporate this into care planning and treatment. And you can explore a child's community and social resources through simple things like genograms, eco-maps. And you can also look at utilising more peer support services, which really provide help based on the knowledge that comes through having that shared experience. Another thing we can do to improve our own navigation and referral skills. so that we can really help children and youth access the care they need when and where they need it. So how do we improve service navigation skills and find a way around this very complex system of care? Well, I think it's really important and easier to navigate something when you're aware of what is available. Next slide, please, Petra. So throughout BC and Interior Health, there's a multitude of amazing resources. Some are unique to the communities in which you live, and others will be more broadly available. Unfortunately, today, we simply do not have time to capture the diverse range of resources out there. So instead, we'll be focusing our attention on the larger, more broadly available services. But following today's session, I would really encourage you to take time to get to know the community assets that you do have in your local area, you know, the people you work with and the structures you work in. And there are many ways you can do this. You can either do a simple online search. You can learn about the structure and history of your area. You can request meet and greets with your local service providers, or attend shared learning experience like today. However you choose to do it, the important thing is that you do it, because it's really difficult to navigate anything without some sort of information to guide you. And then once you do get to know your local service, what you'll quickly discover is that the mental health and substance use care continuum is not only a shared responsibility, it also spans many levels. Next slide, please. Gone backwards there, Petra. There we are. So there are many different ways of referring to the levels of service that exist in the care continuum for children and youth. And you'll typically hear everything from tiers to classifications of interventions. But for the purpose of time and simplicity today, I'll be breaking this down into a simple three-prong approach. So universal, targeted, and specialised. Next slide, please. So let's start with what should be the very beginning of the care continuum, universal care. So these are typically health promotion services, and they tend to be available on a universal level. And what that means is they support the full population and are, or should be, accessible to all people without the requirement to have a special need or a specialist referral. So typically, health promotion and education is provided in school settings through support of teachers, population health staff, counsellors. Public health and population health tend to focus on preventing disease and injuries and promoting good physical and mental health. And then moving along that continuum, we also have the primary care network, which includes family practitioners, and usually in the communities lucky enough to have them, they're usually the first point of contact in the healthcare system because they provide the day-to-day healthcare. Next slide, please. So sitting between universal and specialised is this more intermediate tier of services, which provides that targeted support and resources for those who require input above what is generally provided to all children and young people. Now, there's a lot of services that fall within this range, but in a very broad nutshell, mental health services are provided by the Ministry of Children and Family Development through Child and Youth Mental Health Services and Indigenous Child and Youth Mental Health Services. Boundary and Friendship Centres tend to provide one-stop hub-style community-based mental health services for children and youth. And Boundary also provides virtual services for communities which typically don't have access to those more centre-based teams. And then health authorities such as Interior Health provide community support for children and youth who have substance use concerns. Next slide, please. And then at the highest end of the care continuum, we have the more specialist resource-intensive services. So these services provide care for people with the most complex mental illness and substance use disorders, which typically cannot be delivered at the community level. And most of these programs will usually require referral from a specialist. In its simplest form on the slide there, you'll see Interior Health provides services to those experiencing acute illness where hospital-based psychiatric care is clinically indicated or where there is an acute risk of harm. And then the Provincial Health Services Authority tends to oversee the coordination and delivery of provincial programmes such as BC Children's Hospital, which typically is only available in one area of BC. Next slide, please. So together, these various organisations make up the Care Continuum, which is this end-to-end system of mental health and substance use care, capturing everything, as we discussed, from health promotion, prevention and early intervention, through to those community-based supports such as child and youth mental health and substance use counselling and treatment services, right up to those hospital-based and emergency and crisis services, as well as inpatient care. And of course, there's a huge overlap between these levels, and with multiple touch points becomes multiple access points. So it can be very difficult to know which service is the right service for the youth you are supporting. Next slide, please. So exactly how do we know which service is the right service? How do we match a service based to a child and youth's needs? Next slide, please. Well, services tend to be matched to a child based on the acuity, chronicity, or complexity of that child's mental health or substance use concern. And as such, you will typically, no doubt, hear language of mild, moderate, and severe. Well, it's quite elusive, and we're often asked, well, what exactly does it mean to say that someone has a mild, moderate, or severe illness? Does it refer to severity of the number of symptoms a patient has experienced, the intensity of those symptoms, to symptom frequency or persistence? And the truth is, there's actually no ultimate consensus or uniform overriding principle in distinguishing between these levels of severity. Some definitions will emphasise the number of criteria met, some will emphasise the core feature of the disorder, and some are based on distress. And whilst measuring symptoms makes sense, because they are the most proximal indicator we have of a disorder, unfortunately, these indicators will only take us so far. What remains unanswered is whether the symptoms provide us with an understanding of the actual impact the condition is having on the child's overall life. Next slide, please. So severity based on impact is where we typically go. So how do we measure this? Well, there's a myriad of ways of defining severity, and different organisations will typically use different screening tools to help determine both severity and thus eligibility for a particular service. Now, for those interested in learning more about those screening tools and screening processes, there is going to be an echo session in November, which will go into that in more detail. In the meantime, for those who don't have a plethora of screening knowledge or tools on hand, a key point to remember is that when we're considering severity, it's really important to explore how the mental health and substance use concern affects the child's ability to perform certain life functions. So how their ability to form healthy relationships and have positive interactions with others, their ability to achieve, perform and succeed, their sleeping habits, self-care, hygiene, sleep patterns. All of these interrelated components need to be considered if we're really going to ensure referrals that we make are timely, appropriate and relevant. Next slide, please. Okay, so now we know what services are generally available across that little continuum of universal, target and specialised. We have a basic understanding of severity based on mild, moderate and severe in relation to impact. Now, how do we access that treatment? Next slide, please. Well, like every other side, this one doesn't have a straightforward answer either. So, for example, for MCFD, child youth mental health services, children and youth can typically access support at one of their local intake clinics. Clinic times and locations will vary in each area, so it's really important you contact your local service to find out more. For Indigenous CYMH, again, processes vary by organisation and area. Some are through referral forms, others can be accessed through outreach. So I would really encourage you to reach out to your local team directly for more information. For Foundry, you can utilise there's a Foundry app, and through that the child and youth can access drop-in schedules, counselling appointments virtually, find peer supports, join groups. And for interior health, you can call the 310 MHSU line, where you'll be connected with your local mental health and substance use service. So basically, how you access a service really depends on the service you are trying to access and where you're located. Next slide, please. Which is really why it all comes back to one of the first slides in this presentation, which is about getting to know your local resources. Once you build those connections in your community, you will have a clearer understanding of the support they offer and how to access it. And it will also open up the opportunity for case discussions, care planning, and really help you to bring together a child's circle of care. So by that, I mean the care team that is supporting that child, which is really helpful as you start formulating care plans and treatment plans. Next slide, please. You can also access a range of service information through the Wellbeing website, which provides this handy little search guide to help you find the right information and services based on a child and youth's need. You'll see on the slide there, that's a little snapshot of the kind of things you can put in to narrow your search field down on that website. Next slide, please. And that is the care continuum in a nutshell. There are references in the following slides, but in the meantime, I will hand you back to our facilitator, Jade.